Well, hi there. This is 𝗃𝗄𝗿. I've been in the industry for 25 years helping people with Medicare. And today I want to answer the question, how do you find the best Medicare Advantage plan for you? Let's say that you watch the commercials or you look into it yourself and you want a zero premium Medicare Advantage plan. What is it that you're supposed to look for? What is it you're supposed to look at in order to determine what's best for you? So I'm going to go through that, give you some criteria, and I believe it will help you in your decision making as to what might be the best Medicare Advantage plan for you. First of all, what are your non-negotiable doctors? That is, the doctors that you insist you must be able to see these doctors come hell or high water. These are the doctors that you have banked your life on. You spent years and years going to them for care, and these are the non-negotiable doctors that must be in your network. If that's the case, if there are such doctors, you need to make sure they're in the Medicare Advantage network. I'm going to share with you in just a second how, even though they're in the Medicare Advantage network today, that might not mean that they'll be in the Medicare Advantage network all through the calendar year. And Medicare Advantage plans are calendar year plans only. They reset and they change their benefits every single calendar year. So what you might enjoy as a benefit this year will be totally different, could be, next year. That's including your deductibles, your out-of-pocket, your network, your drug plans, your drug tiers, your drug cost, your drug formulary. Everything that's in that Medicare Advantage plan is up for negotiation again in the next year. They change every single year. The other thing is, what is your non-negotiable hospital network? Here in South Carolina, we have MUSC. Out in Los Angeles, they have different hospital networks that are crucial for people to decide on whether or not they're going to have that hospital network in their Medicare Advantage plan. So you need to know that that hospital network is rock solid. That's kind of an oxymoron in the Medicare Advantage network, and I'll show you that in a second. The ability to go outside the network. What are your options? Let's say that the best specialist that you need for a developed condition that you have had, and most people when they're turning 65, they want the cheapest plan. They want the lowest premium plan. Why? Because they've been healthy their entire lives. Listen, I've only had 30 or 35,000 encounters with seniors from turning 65 and beyond. And I can tell you, this is a fact. When you're 65, you are the healthiest you will ever be on Medicare. And the mistake that most people make is to assume that their health at age 65 will be the same health that they will enjoy at age 70 and 72 and beyond. So the ability to go outside of a network, and that's what you're giving up with a Medicare Advantage plan. You're having everything within a network that is renegotiated and can change every single calendar year. That network is crucial to your ability to go forward. So let's see, what if the cancer doctor that you want to go see, let's say you develop cancer at age 69, 72, happens all the time. The cancer statistics are very significant when it comes to the Medicare population. So let's say that Cancer Treatment Centers of America is not in your network. Is that a big deal? How about MD Anderson, Johns Hopkins, those kind of networks? Are they in your network on your Medicare Advantage plan? If not, you at least have the opportunity to go to those using a PPO. We'll talk about that in just a second. Star ratings. That is one component of the Medicare Advantage calculation. Now, with the Medicare Supplement world, totally different world we'll talk about in just a minute, Medicare Supplement world does not have star ratings. Why? Because you can go anywhere you want to. There is no network. There is no consideration of hospital networks or doctors or referrals or prior authorization. That just doesn't happen in the supplement world. And again, we'll talk about that in just a minute. But star ratings on Medicare Advantage are very important criteria as to whether the person got back enrolled into the hospital, if they got dismissed from the hospital because everything's fine, they got discharged, no problem, but then they had to be readmitted. That usually indicates something was wrong when they were admitted in the first place. That's part of the star rating. Also, customer satisfaction is part of the star rating. Some other important benefits that are on Medicare Advantage plans, they may tell you that they're going to have a dental plan. You need to look very, very carefully at what they consider a dental benefit. Sometimes they're only a cleaning. Sometimes they're only a cleaning and Category 1 services, which means like a filling. But when it comes to full mouth extraction or dentures or the other things or implants, they are far lacking in most plans because they just want to check the box in many cases, and I'm just being frank with you, on saying they have dental coverage, but when you look at major dental coverage, they just don't exist at all. So you need to look at those details when you're being lured away from original Medicare, which is your right, you paid into it for a whole entire life, into giving up original Medicare and going into a Medicare Advantage plan. I'm going to give you some of those considerations here. So first of all, the question is, Is Medicare Advantage really Medicare? Is it really Medicare at all? Listen to this.
This is an important message about Medicare.
Hi, I'm Congressman Mark Pocan.
Hi, I'm Congresswoman Jan Schakowsky.
Hi, I'm Congressman Ro Khanna.
And I'm here to talk to you about Medicare Advantage.
About Medicare Advantage.
About Medicare Advantage.
Yep, that's me. You're probably wondering how I ended up in this situation.
We want to make sure America's seniors know that private, for-profit insurance, also known as Medicare Advantage, is not Medicare.
And that's why we just introduced the Save Medicare Act.
Private health insurance companies get seniors to sign up for private plans rather than Medicare by calling themselves Medicare Advantage.
But Medicare Advantage is neither Medicare nor an Advantage.
These plans seem cheaper or seem to offer additional benefits, but in the long run, they often don't cover the more expensive care that many retirees need.
So we want to stop private plans from calling themselves Medicare
and protect actual Medicare,
making sure seniors' care is covered for the rest of their lives by a program with the power of real Medicare.
So don't be fooled by the commercial gimmicks.
And don't call 1-800-anything.
Get the program you've paid for and earned. Remember, only Medicare is Medicare.
Only Medicare is Medicare.
Only Medicare is Medicare.
Medicare Advantage is not Medicare. And what these nice Congress people are trying to tell you is that is a fact. When people say that Medicare Advantage must be as good as or better than original Medicare, what they're saying to you is honest. If you read between the lines a little bit, what they're saying is Medicare Advantage is not original Medicare. What is Medicare? That's what you paid into with every paycheck that you ever worked in your entire life. That's what you earned. However, Medicare Advantage is being paid by the federal government to take you off of original Medicare, and they put you into, in most all cases, a network, and that's how they manage your care. They manage the cost of your care. So the biggest question that we're always asked is, well, what happens if my doctor that I signed up with on a Medicare Advantage plan because he participates in my whatever Medicare Advantage name of today is, whether that's Devoted or Humana or United Healthcare or Aetna or any of the HMO plans, what happens if my doctor leaves that plan? Does that mean then that I have a special election period and I can, because my doctor left, now this can happen, let's say you sign up in a plan January 1st, that's typical, and your doctor leaves the plan in June. Can you then leave that plan in June and go to a different Medicare Advantage plan where he might be in network? The answer, unfortunately, is no.
Before you have surgery or even a preventative exam like a mammogram, you probably make sure that the medical center is in network with your insurance.
But News 4 Investigates is finding complaints of people getting high bills from out-of-network doctors, even if they go to an in-network hospital.
Our chief investigative reporter, 𝗪𝗻𝗄, is working for you tonight to help you avoid bills you'll never see coming.
This was the first one I got.
Like most of us,
The facility doesn't know, da-da-da-da-da.
when 𝗏𝗏𝗄 got her insurance coverage statement, she was a bit...
I got this letter from, well, first I called. Here, I'm not doing this in the right order.
confused.
4 pages, front and back, of healthcare mumbo jumbo.
Especially when her preventative mammogram, which she'd never been charged for before, was performed at a hospital in her insurance network. But afterwards, she got a hefty bill from an out-of-network doctor.
I had gotten bitten by, I think, a spider.
𝗀𝗏 made sure to choose an in-network hospital when he had an emergency. And he, too, got a high bill afterwards from an out-of-network physician.
It was just a little bit under $1,000.
So hold up. You pay insurance and choose in-network medical center to avoid an out-of-network doctor, right? Well, our investigation found, forget all that. It can happen anytime, and no hospital is obligated to tell you. Remember, while a hospital or clinic may be in-network, That doesn't mean their doctors or specialists are in network or are actually their employees. Look at Pastoric's insurance coverage statement. Clearly states an out-of-network provider was her radiologist. When she appealed, here's how she says her insurance explained it.
Even though St. Thomas Midtown is in network for you, that radiologist is out of network. And I said, well, then why didn't the facility warn me?
Showalter had the same question because he too went to a St. Thomas hospital.
It makes me feel incredibly taken advantage of.
Despite our repeated requests for an interview, St. Thomas declined. A spokeswoman writing in part, though we strive to stay aligned on in-network status, there will occasionally be instances where a physician or contractor is out of network. But there's nothing occasional about hospitals and medical centers doing this, according to the Kaiser Family Foundation, which studies national health issues. They say, on average, 1 in 6 planned procedures result in an out-of-network bill. 𝗂𝗄𝗄 is with the Kaiser Foundation.
This is kind of the number one affordability concern among privately insured people.
Okay, so what do you do if you've got a procedure coming up? You start asking questions immediately, especially if you need these specialists. The Kaiser Foundation says these are the ones most likely to be out of network. And if you need them, you ask on the front end if a specialist can be used that's in your network.
I think it's incredibly screwed up.
So if you've got this kind of surprise bill, you really have 2 choices. 1, realize hospitals don't have to tell you a thing, and you pay it.
I tried to fight it for a good 4 months, and I couldn't. Nobody was willing to help me at all, so I just ended up paying it.
Or you fight it. You appeal it over and over. In Pastoric's case, she won and didn't have to pay a dime, avoiding a financial pitfall too many fall into.
Most Americans don't have $400 to pay for an emergency.
Jeremy Finley, News 4 Investment.
So what I think it's important to understand, if you're going to choose a Medicare Advantage plan, most of them are HMOs. Over 89% of them are HMOs around the country. And some agents will even try to tell you, you can choose a Medicare PPO plan. Now, PPO plan will solve all the problems of not having access to out-of-network doctors. But will it? Well, with my 25 years of experience, let me share with you how a Medicare Advantage PPO plan works. First of all, the small print that you have to agree to is that you understand that the doctor that is not in the network must agree to accept what the payment is that your Medicare Advantage provider proposes to pay and must agree to bill your Medicare Advantage provider. Now, common sense might dictate that if they had chosen to accept the rates of a Medicare Advantage provider already, and they had chosen to bill that Medicare Advantage provider directly already, then they probably would have joined that Medicare Advantage network already. The fact that they didn't might be what we call in the detective work a clue. They decided not to join that Medicare Advantage HMO network. They decided not to accept what that Medicare Advantage plan would pay, and therefore they are out of network. So the chances of that person accepting your PPO plan for the out-of-network benefit, that, by the way, usually means if you're billing them out-of-network that your max out-of-pocket is double, usually $10,000 or more out-of-pocket maximum that you have to pay for an out-of-network provider. That means it's very slim chance that that out-of-network provider is willing to bill at the rate to the company and do a one-off billing for your benefit. Now, another question we get is, what happens if your Medicare Advantage plan denies your procedure? Well, according to a lot of research done by the Office of Inspector General of HHS, which I'll go into in just a second, this happens a lot. And when this happens, you have an opportunity to appeal. They just said that in the last segment. You have an opportunity to appeal. And when you appeal, guess what? You go to level 1, they can say no. You go to level 2, they can say no. You go to level 3, and then you go to a hearing, and then you go to level 4, and then you can go to a judge, level 5. Now, let me explain what's going on when all these appeals are happening. Number 1, you're usually suffering from a serious illness. You're in the hospital, or you're out of the hospital waiting to get relief from pain. Relief from pain is not the best state of mind for you to wage your own war with an insurance company. and to try to get your way. So if you have an advocate at home, you have a husband, a spouse, or a husband or a wife, you have somebody at home that's living with you, maybe an adult child, and they can be your advocate, yes, you can designate them with your Medicare Advantage plan to be your advocate and go fight these battles for you. However, I just want to let you know that sometimes with health conditions, and again, this is 25 years of experience sharing this with you, you have a deadline in which you need to seek relief from pain or get a solution to a medical issue that is time sensitive. And as you look at these 5 layers of appeal, I want you to think about each one of them has about a 30-day window from which you can make the appeal, and they have to reply to that appeal and either accept it or decline your appeal. Just think of that. You're suffering from some kind of condition. The health plan tells you no, it's too expensive, and that's how they make their money. They manage the difference between what the government pays them for your care and what they actually pay out in your care. That difference is called the profit margin. And that's why they make money. It's because they save money on that. Now, this study that I've covered in depth in the past, and I really suggest that you subscribe to our channel so you can see these kind of updates because I cover this in depth. The Office of Inspector General of HHS, which is over Medicare, did a study on this. This one is from 2018, and it was the Medicare Advantage Appeal Outcomes and Audit Findings. They raised concern about this very thing, and that is the denial of care with Medicare Advantage. This is not with original Medicare. This is only a facet of Medicare Advantage. And it says here, put my glasses on and zoom in for you. When beneficiaries and providers appealed pre-authorization, or prior authorization as it's typically called in the industry, that is to get their permission first before you have something done. And they say, no, it's too expensive. They want to save money, and that's where Medicare Advantage plans make their money. So when they say no, and you appeal, and payment denied, Medicare Advantage organizations overturned 75% of their own denials in 2014 to 16. I'll show you a more relevant study here in just a second. They overturned 75% of their own denials. 75%, 3 out of 4. However, overturning more than 216,000 denials each year. During the same period, independent reviewers at higher levels of the appeals process overturned, this is more levels, okay? This is level 3, 4, and 5 of the appeals process. Higher levels overturned additional denials in favor of beneficiaries and providers. The high number of overturned denials raises concerns that some Medicare Advantage beneficiaries and providers were initially denied services and payment that should have been provided. If you were on original Medicare, which I'll talk about in just a second what that option is, if you were on original Medicare, it would have never been denied in the first place. But since you're on managed care, which is Medicare, quote, Advantage, it was denied and it should have been already provided. This is especially concerning because beneficiaries and providers rarely use the appeal process. This is why I said loudly, you need an advocate for you in the healthcare world. If you know anybody that's a senior or they've been aged 75, 80 years old and they're in a hospital and the hospital starts to maybe possibly neglect their care, or an insurance company will say, no, we're not going to do the CAT scan or the MRI. We're going to opt for the x-ray instead. But you say, but wait, my patient, my mom, my wife is suffering in pain. Let's get to the solution right now. They'll say, no, that's too expensive. We're going to do the cheap test first. They need an advocate in the hospital, especially if you're on a Medicare Advantage plan. Please listen to what I'm telling you. I'm sharing with you the stories and the tragedies of others so that you don't have to participate in that yourself. You need an advocate that can go into the hospital and raise holy heinous with the insurance company. This is especially concerning because the beneficiaries and providers, let's see here, is it going to turn that on? No. The beneficiaries and providers, rarely use the appeals process, which is designed to ensure access to care and payment. Beneficiaries and providers appealed, wait, how many is that? 1% of the denials. They only appealed 1%. But when the Office of Inspector General went back and said they would have overturned 75%, but wait, they would have overturned more had you gone to higher levels of appeals. Well, who has the time to do that? So you say, wait a minute, that was just a 2014 to 2016 study. What's something more relevant? Well, guess what? As fate would have it, you have it here. This is a study from 2022, April of 22. Some Medicare Advantage organization denials of prior authorization requests raise concern about beneficiary access to medically necessary care. Well, if they deny it at the prior authorization level, that means you ain't going to get it unless you start the appeals process there. Now, bear in mind, what are we talking about? We're talking about somebody who's in pain and they're waiting for a solution to their pain. We're talking about somebody who has cancer and they're waiting for the eradication of the cancer with the most aggressive means and most effective means possible. But you have a health plan that says we're going to save the most money possible because remember, you're paying no premium. So what do you expect? You're paying no premium. You gave up original Medicare where you can go to any provider in the entire country. You gave that up. What did you give it up for? You gave it up for a cheap network plan that has the opportunity to deny you care. So what does this study say? It says 18% of payment denials were for claims that met Medicare coverage rules and Medicare Accountability Organization billing rules. Well, the interesting thing is if 18% of them should have been paid and they would have been paid, the literal interpretation of this is he would have been paid under original Medicare. 18%. What does that mean? Oh, I don't know. 80-something% of people would have been fine, but are you in the 18%? Of the 160,000 payment denials issued by the 15 selected Medicare Advantage organizations, just in this study, in the first week of this study of June 2019, 18% met the Medicare rules. They should have been paid. What's going on? They should have been approved. This projects to 28,900 payment denials that met Medicare rules, billing rules for the selected Medicare Advantage organizations during that week. For an annual context, if these Medicare Advantage organizations denied the same number of requests in each of the other 51 weeks of 2019 when they looked at, they would have denied, what does that say? 1.5, it's only 1.5 million requests that met Medicare rules. Denying payment requests that these meet rules delays and prevents providers from receiving payment for services that they have already delivered to beneficiaries, which can burden providers. Why would a provider choose to leave a Medicare Advantage network? Maybe because they thought it was so dadgum necessary, medically necessary, in fact, that they provide this needed life-saving treatment, and yet it was declined in prior authorization or declined in subsequent review. Okay, so you still want a Medicare Advantage plan because it's zero premium. You can find them at MedicareAdvantageNearMe.com. That's my website, MedicareAdvantageNearMe.com. Typically, you can only sign up for a Medicare Advantage plan during the annual election period, which is October 15th through December 7th of every year. October 15th through December 7th, you pick a Medicare Advantage plan or a Part D drug plan standalone. Either one of those happens during the annual enrollment period, and then it takes effect in January the next year. So as of January the next year, if you signed up for a Medicare Advantage plan, you are no longer participating in original Medicare. You've opted out. And for the entirety of that calendar year, you are now subject to the rules, requirements, prior authorization, referrals, and limitations of networks of your chosen Medicare Advantage plan. I'm not saying it's the best thing for everybody to either get one or not get one. I am saying that most agents out there and most agencies and call centers will not inform you as to the potential downsides of being on Medicare Advantage. I will because I live it and I can't sleep at night if I put somebody on a Medicare Advantage plan and they don't know what's possible. That's why. It's called a conscience. Anyway, you can go to MedicareAdvantageNearMe.com if you're in your open enrollment period. That is, you just turned 65 and you're wondering, where do I go? What do I sign up for? You've got a window there that you can sign up for a Medicare Advantage plan. 3 months before you turn 65, you can choose it. The month that you are 65, you can choose it. And 3 months after you're 65, you can choose a Medicare Advantage plan. If you choose a Medicare supplement, which I'll show you in contrast here in just a second, on a Medicare supplement, you can choose that for an entire 6 months after you turn 65 for a Medicare supplement, which means leaving you on a real Medicare with the opportunities and rights that that affords you and the ability to go anywhere, that's a longer period of time, a longer window. And anyway, here are some other sites where you can find Medicare Advantage information. Now, with Medicare Advantage, it's true, there are restrictive networks. Generally, the restricted network makes you stay in the service area of that plan. Prior authorization is a component, which means anything that's going to cost money, they want to look at, and they want to give you an opinion first as to whether they're going to pay it or not. You better get that prior authorization before CAT scans, MRIs, hospital admissions for sure, unless it's an emergency, and then they'll go back retroactively and look at that and see if it was an emergency on their criteria. They have up to or more now, a $7,500 annual max out of pocket that comes out of your pocket. They have a calendar year contract, which means the doctor can leave the contract anytime. You can leave their contract at the end of the calendar year. But the doctor, again, can leave the plan anytime. And we just showed a couple of stories where the doctor could leave the plan at any time. Here's another one.
Dozens of viewers have now sent the problem solvers their surprise health care bills. And this week we get results for a Glen Allen woman who says now she's going to think twice before seeking medical treatment.
Well, it's a nice night. The weather's nice.
At home in Glen Allen,
Yeah.
the Jackson family wants to hang out.
Yeah, that's good.
Mom Lynette is happy to be here and to be healthy. After spending time at Henrico Doctors Hospital with persistent abdominal pain.
It makes me not even want to go to one.
That bad taste in her mouth came only after she left the ER and received a surprise bill.
And I feel like I, as a customer and a patient in that hospital, should have been told that the doctor was not in my network.
Her network, through Anthem Health Insurance, included the hospital, but not the attending physician, according to the $1,037 bill he sent her.
It seems grossly unfair that an individual should have to pay 90% more than what a huge insurance company would have had to pay.
Lynette wrote a letter to the doctor asking him for an adjustment.
And I've gotten nowhere.
And filed an appeal with Anthem, but didn't hear back from either.
These are giant corporations that you're dealing with. And I'm just a person stuck in the middle, trying to be treated fairly.
So the problem solvers reached out to Anthem and HCA, the parent company of Henrico Doctors. Once again, within days, we got results. The bill has been settled.
Tremendous relief.
But Lynette still doesn't understand why she ever received one.
I was really shocked. I just didn't know that that could even happen. Because I'm following what the guidelines are. They want you to go in network, and I thought I had done the right thing, and then I get this bill in the mail.
We requested comments from Henrico Doctors and the insurance company.
Happens all the time when you have a network. That's the nature of the beast. You have a network, you are going by their rules. Anyway, on a Medicare Advantage plan, if you find yourself on one and you want to change to a different one or go back to original Medicare, you can still do that during what they call their open enrollment period, which is very confusing because they also call the annual election period the open enrollment period. Anyway, this period is from January to March 31st, and you can change or opt out of a Medicare Advantage plan if you signed up for one every year. Now, in contrast, I want to show you the difference between these two options. When you're new to Medicare, or if you can later qualify, you have two roads you can go on. And I wish I could put myself in the middle of this thing, but I just can't. So you have the opportunity to go to original Medicare, and I would suggest having Medicare Supplement, which pays the other 20% that original Medicare does not pay. And no, it's not free. Surprise it to say that the best possible coverage that you could possibly have as a senior on Medicare is not free. Put that out there in advance. It's not free, but you can go to any doctor in the country and any provider, any cancer treatment center, and any specialty hospital that accepts Medicare, which is most all of them. You can go anywhere in the United States, no prior authorization, no referrals needed, very low out-of-pocket cost if you have a supplement, and it's guaranteed renewable. You only have to qualify either the first time you're ready for Medicare, there's no health questions at all, or you go through a couple of health questions to see if you can qualify later in life if you missed your first open enrollment period when you were brand new to Medicare. On the flip side of the coin, you've got the Medicare Advantage plan with the networks, the prior authorization. They decide what you're getting, and they can change those networks at any time. I just want you to know there are options here. And what happens so frequently, which makes me the saddest, is when someone has turned 65, and they told me, and they told my staff here, I'm 65. I've been healthy my entire life. I take literally no drugs. I just take vitamins. I run, I ski, I surf. I do everything to keep myself healthy. And I don't need to pay a premium for access to Medicare. So I'm going to go with one of these commercials, and I'm going to go with a Medicare Advantage plan at 0 premium because I'm healthy as a horse and I'll never need it. Only then to find out that life, or Murphy's Law, takes effect sometime between 67 and 72. The chronic things start to happen and they start to break down. The challenge is this. If you want to go back to a Medicare supplement, have everything else covered, get off of the Medicare Advantage free plan, you have to go through health questions. And if you've triggered those chronic ailments at that time, and I'm talking about you just had a heart attack, stroke, cancer, just hospitalized for something like that, or you have diabetes with complications, you're not going to be able to go back to the blue side of this page. You're just not. And that's the biggest frustration for an agent that has both sides available to them, like I do. We can do original Medicare with the supplement. We can help with that. Or we can do a Medicare Advantage plan. We can help with that too. However, the road is empty. No more options left for you if you can no longer qualify with the health questions for a supplement later in life. It's like your house is, you bought a house, it's a beautiful house, it's a brand new house, and you think, I don't need any coverage for that house. I don't need any insurance for that house. And then something happens in the laundry room and it catches on fire, and then you think, oh my God, I need homeowner's insurance. I need to get some insurance right now for my house. That's the time when you can't get it. Or a tornado it happens through your neighborhood, or a named hurricane happens and it's coming right for your house. That's the time after there's a named storm that you can no longer qualify for insurance. Why? Because it's already coming at you. You already have that kind of condition. Insurance in the insurance world, from what I've learned, is you have to have it in place before you need it, and then it's there for you. You can't have insurance when your house is already on fire. That just doesn't happen. So, like I said, with original Medicare and Medicare supplement, there are no health questions when you're within 6 months of starting on Medicare. And you're starting your Part B. So if you're working in an employer plan and you work there for 2 or 3 or 4 more years, you never needed to start Part B of Medicare, but now you are. When you start Part B, that's when the clock starts ticking. You've got 6 months to go either way. You could have chosen a Medicare Advantage free plan and go to all the restrictions and network limitations there and the coverage of care choice limitations there. Or you can go with original Medicare that you've paid into and invested in your whole life, and you can go anywhere you want to. But after that period, after that finite period of time ends, then you have to go through health questions. There's no physical exam involved in underwriting. It's just simple health questions that we do for people every day. Matter of fact, we call and reach out to every one of our clients every single year and give them an opportunity to go into a different Medicare plan that may be better for them. And it only is up to whether or not they can qualify with the health questions. That's it. But you can get on a Medicare supplement plan if you don't have one any time of the year. And you can change a Medicare supplement plan any time of the year. You don't have to wait for a period of time. Matter of fact, the worst time you can do it is to compile that time into the Medicare Advantage annual enrollment period of October to December. That's when a lot of people say, I want to change my Medicare supplement plan. Well, we could have done that 365 days a year when we have more time, more downtime than in the compressed period of when all the Medicare Advantage plans have to do their decision making at the last part of the year. And with original Medicare and a supplement, some agents who push Medicare Advantage all the time, they'll say, yeah, but with original Medicare, you have to add a drug plan. Is that a bad thing? I don't think it's a bad thing, because the drug plan that you add could be as little as $6 a month. It could be as high as $70 a month, but it can be tailored to what you need. You take a lot of tier 4 and tier 5 drugs. Well, let's get a drug plan that's the best for you. We do that, by the way, at a little website called Start Part D. There's a drug plans under Part D, startpartd.com. You can see what those drug plans are. But if you get a drug plan that's specially designed for you, and by that I mean you put in your drugs and then the plan decides, wait a minute, this is the best drug plan for you based on what you're paying, it equates to the lowest out-of-pocket cost for you possible for the year, as opposed to Medicare Advantage plans, which is a one-size-fits-all, just shoved into your major medical plan, is a drug plan. You cannot decide, wait a minute, I want to pull out that drug plan component because I'm paying too much for drug with my Medicare Advantage plan. Let me change it for a different Part D plan. That doesn't happen. Medicare Advantage is a one-size-fits-all, one solution for everything. So the drug plan part that you get with a Medicare Advantage HMO may not be the best drug component for you. I found in my experience that if you want the most tailored plan for you, you get a Medicare supplement plan, which covers everything else and the freedom to go anywhere else, and you pick a drug plan that's specifically tailored for you and your pharmacy, you and your medicine cabinet. And then we've got a dental vision hearing plan that's second to none, lets you go to any doctor, any dentist, any vision or any hearing provider in the country and pays toward those bills. You're not restricted again to a network or a gimmicky plan that is often found in a Medicare Advantage HMO where they say, we have dental, we have vision, we have hearing. Really? Let's look at those details very carefully and see what kind of a network restriction or coverage restriction you have when you say you have dental. Is it comprehensive dental? Usually not. So again, here's some dates involved. All year round, you can change your Medicare supplement. Anytime you want to, you can change your Medicare supplement. However, for a Medicare Advantage plan or a drug plan, you can only change those from October 15th through December 7th. And then this other time of the year, right now, January 1st through March 31st, you can change your Advantage plan or leave Advantage plans altogether. Just important on the timelines there. If you found any value from this or any other video that I've ever done, please do me a favor and comment in the comment section below of what you thought was interesting here. Don't ask questions in the comments, please, of your personal situation. For that, you can reach out to us directly, and we'll give you personalized help. It's not a good idea to paste in the comments what your health situation is or when you're going on Medicare and all that kind of stuff, because all that could potentially happen is other scammers could reach out to you. The best thing to do is comment on what your comments are on this particular video and reach out to us for specific help. How do you reach out to us? Good question. I'm glad you asked. Here's a code that you can just scan on your phone if you've got a smartphone out there. Go to the camera setting and take a photo of this. But before you take a photo, just hover it over this and it'll take you right to our website where you can get Medicare help. There's a secure form there where you can put your information in and we can give you at least a second opinion on what your coverage options are with Medicare. And a second opinion, or even our first opinion, even if we help you with the entire enrollment process, it absolutely costs you nothing. Nothing at all. Our service is free. Doesn't cost you a thing. We're paid by the insurance company if you ever want to go with the products of the insurance company. Here's a couple of websites that might help. If you're on a Medicare Advantage plan, if you're on a Medicare supplement plan and you want to see about going to a different one and saving money, sometimes we'll save people $50 or $100 a month by going to a different Medicare supplement plan. And all we have to do is go through underwriting. If you go to this website, seniorsavings.org/underwriting, you can see what's involved in underwriting right there, /underwritten. How to start Medicare. Where do I sign up for Medicare? What plan do I go to? What website do I go to? All that information is available right there. Let's see if I can put this on. That's howtostartmedicare.com. If you're looking for a drug plan and you're new to Medicare or it's during the annual election period when you're watching this, you can go to startpartd.com and see what your drug plan options are. If you want to see why Medicare Supplement Plan N is, in my opinion, the best for about 85% of the people on Medicare, go to planinmedicare.com or .org. And you'll see there's somebody on the YouTube right now that's telling people that Plan G is the only way to go. It is the best and only way to go. I'm going to have a video about that, addressing that shortly. But I believe that anytime you incorporate fear with trying to help somebody on Medicare or trying to sell a product or try to do anything with Medicare or anything else, and it's all based on fear and lies and a distortion of what the facts are, then you're not going to be rewarded ultimately for that. And there's some people out there saying that you need to go to Plan G only if you're going to choose a Medicare supplement plan, only Plan G. And here's the fact behind the story. Medicare Supplement Plan G pays us on average 20% higher commission than Medicare Supplement Plan N does. 20% higher. So if you look over the course of a career, an agent can maybe have 10,000 enrollments in a Medicare plan. If I have 10,000 enrollments in Medicare Supplement Plan N, which we write 90% of the time with supplement people after doing an extensive analysis and listening to their needs, that means we make 20% less times 10,000 people. Or, on the flip side, if our competitor is out there on YouTube telling everybody that Plan G is the ultimate, the only, and the safest way to go, because they're being scared of excess charges, which are not even a consideration. They're not at all. That fear, if they instill that in you enough, effectively enough, will result in a 20% more commission times ultimately 10,000 people. Just think of the ultimate, what is behind them saying that I need to pay 20 or 30% more for my premium? Are they really looking out for me? Are they making it so simplistic that I'd be like, oh, I'm scared of an excess charge, which is not even a factor. Now look, we only have about 13 or 15,000 people right now on Plan N, and I know what excess charges are, and they're an absolute non-factor. However, people are on this very channel on YouTube telling you you should be scared of excess charges because everybody's going to charge them to you, and you can't afford your Medicare or your health care. That's a topic for a different video. Don't be led by fear of anybody that tells you fear, especially fear from inexperience and not having put people on that plan to begin with. Look at the research on planinmedicare.com. If you go on plan, I'll just leave it with this. Look at my research at planinmedicare.com. If you compare what you're going to have as a rate increase experience on Plan N versus Plan G after 5 years, then you come back to me and tell me if it was a good idea for you to be on Plan N or not. You just tell me. If you're going to have a 0 to 5% rate increase versus a 10 to 20% rate increase on the difference of the two, tell me which person was looking out for your advantage going forward for 5 years, and come back and tell me. I can tell you what thousands of people have told us. You'll probably see them in the comments. We look out for you, not our bottom line. Another thing you can look at there, all about MedicareAdvantage.com. If you're considering a Medicare Advantage plan, look at my research, look at what's been said in the industry, look what other people are saying that have actually experienced about Medicare Advantage. It is in your best interest to look at all about MedicareAdvantage.com. Just look at the research. You still want to go to a free plan, a no premium plan? We can help you with that. We can help you mitigate the loss and the disadvantages as best we can, but we're going to look out for you. But look at that research there, all about MedicareAdvantage.com. And then some other things there. If you're on Medicare due to disability that's under the age of 65, you have some different restrictions there. Some different opportunities are available to you, and I explain those on MedicareOnDisability.com. So check out some of those resources. They'll also be linked in the description of this video below. My name is Christopher Westphal. I just want to do the best thing for our clients, and that's why we exist here. If you'd like a second opinion, or you'd like somebody to be passionate and an advocate for you, then please reach out to my organization. I'll leave you with one more video, then I'm out of here, and I'll be answering questions in the chat. Thank you.
People are worried about possibly losing their in-network healthcare doctors or being forced to pay out of pocket for their visits. That's because of a contract dispute between WellStar Health System and United Healthcare. If an agreement is not met in the next 2 days, 80,000 people could find themselves with doctors now outside their network. WellStar has 11 hospitals across Georgia. UHC says its members can still choose from more than 20 hospitals in the Atlanta area. An Emory law professor says these discussions, they happen often and are usually resolved by the deadline.